Welcome to strategic planning. A budget is only as good as the way in which it reflects the plans of the organization. That's another way of saying that strategic planning is needed before beginning any organizational budget. Before focusing on budget numbers, the budget makers must address certain key questions, and different viewpoints help us to focus in on what matters. As a result, it helps to include input from a wide range of people, including managers, workers, and clients, in arriving at answers to each question. First, why does the organization exist? Is it simply to provide jobs for a few workers, or is it to provide certain essential health services to a target community of customers? Who are your clients, and what do they want from the organization? Is it simply to get a shot as quickly as possible, or is it to receive counseling regarding potentially risky behavior? What unique contribution can you provide? Is it better quality services at a lower cost than others, or maybe just to be there when the need arises? What business should you provide? What is the scope of services you plan on providing? Is the service provided free to clients, or should there be a fee for the service? Does the organization need to be financially self-sustaining? By its nature, a budget looks into the future, such as a budget for the next 12 months. But what do you want the organization to look like in 3 to 5 years? Think about what's around the corner. If there are major changes ahead, the sooner you start steering in that direction, the better prepared your organization will be. Being strategic in your planning makes sense. What is the mission of the organization? A mission should be broad but focused on the future. It does not change from one year to the next. Perhaps the agency's mission is to improve the health status of the community. In contrast, goals identify the intended outcomes or priorities. They draw rough boundaries around the areas where management has decided the organization will operate. Examples of goals for a laboratory might include respectful, compassionate, and high-quality patient care, or high standards of clinical laboratory practice and efficiency, or finally, good stewardship of lab resources. But translating goals into doable activities requires objectives. An example of an objective might be to develop 10% of the lab's revenues from client payments, or to test 15% of the target population for HIV in 2 years. These objectives should be short-term focused and measurable with data that you're accurately able to collect. These types of objectives keep the budget itself focused on what will achieve the organization's larger goals and mission. Finally, keep in mind that objectives need to be realistic and achievable, and yet challenging. If they're too easy to achieve, they won't motivate people to do their job to the best of their ability. The annual budget allocates money to achieve these objectives. The budget must be based upon prior performance results and any expectations you have for the new year in achieving the objectives, goals, and mission of the organization. We'll explore in more detail efforts to do strategic planning. Strategic planning requires early attention to the mission statement, which states what the program is expected to accomplish in the future. A well-crafted mission statement allows each individual in the organization to understand their role in achieving the mission. The mission statement should stand the test of time. It's not a one-year focus. Finally, the mission statement must be clear so that funding agencies, potential clients, community leaders, and others outside the organization understand why your organization exists. Doing strategic planning starts with a focus on the organization as it exists now. What are its current programs and activities? Are those the result of legal requirements, contractual agreements, or just the evolution of services over time? What money and other resources are devoted to each program or activity? Who are the constituents for each service? Is there any overlap in services? How do you measure success or failure? That is, what are the non-financial performance measures that are kept in the records, such as the number of clients served per day, the average waiting time before providing service, the cost per patient served, and similar indicators of service quality and costing. Now that you know where your organization is today, where do you want the organization to go in the future? What are the community's unmet needs or opportunities? Are there changes in the political or legal environment that could impact your services? What about alternative ways of providing services that might be useful to consider? Always compare planning efforts to see if they fit the organization's mission. Progress is measured by more than just the amount of money expended. The purpose is to determine how existing measures of performance support the strategic plan. Performance indicators include input measures, such as the number of staff members working on the task. Output measures include counts, such as the number of shots given, the number of days the clinic is open, or other measures on the effort expended to provide services. Outcome measures try to assess the extent to which the activities have the intended effect, such as an increase in the overall health of the target population. Each performance measure should entail data that is available and easy to collect, and relate to a specific goal or objective. Do not just count things for counting's sake. Just as financial data has to be correct, all non-financial performance measures should be accurate and reliable. Progress is tracked through an action plan with detailed steps and deadlines to achieve the desired mission. This plan should show how resources and responsibility are fitted to the elements of the plan. Managers and supervisors need to know, in no uncertain terms, what they're accountable for. A daily, weekly, or monthly tracking system is needed to show results, or the lack thereof. Actions must be taken to correct problems as they occur, and this information should be shared with all of the people involved. As part of strategic planning, it is often helpful to do scenario what-ifs, as in what can go right and what can go wrong. An optimistic scenario is where you assume all good things: growth in the number of paying customers, more grant money or central government allocations, reductions in the public health need, spending less than expected, or no unexpected demand or surges. All of these scenarios will likely produce an improved bottom line, that is, less spending and more income. In contrast, a pessimistic scenario assumes a lot of things can go wrong. Consider what new public health challenges may be around the corner. Generally, pessimistic scenarios will mean less revenue and more spending than expected. Often, an organization has to navigate between the very rosy scenario and the very scary scenario. We can call it the realistic scenario. In conclusion, strategic planning requires a focus on your mission, goals, objectives, and annual budgeting. Remember, a plan is only as good as the assumptions that drive the plan, and those assumptions are subject to change, even during the year. Plans can go wrong, so you have to be nimble to make corrections.